let's turn our attention to a very serious subject as it relates to the screening of newborns. And you may ask yourself, but why do I have to go through all of this? I just want to go home and take care of my baby. If I need you, I'll come back to you. I know that's what you think sometimes, don't you? Well, joining us as we take a look at that is the world's best pediatrician and neonatologist, is my good friend, Dr. Gillian Birchwood. And she's brought along with her a consultant neonatologist in Dr. Tanisha Austin. Ladies, good morning.
Good morning, Pearson.
I hope you're not tired of me saying that every time.
You could say it all day.
Indeed. Let's talk about why we do screening and why newborns ought to be screened. What's the benefit to be derived therefrom?
So newborn screening is a standard of care in the most advanced countries with the most advanced healthcare. And the reason why it is so important is that with newborn screening, you have the chance to detect conditions early on that can cause permanent, irreversible damage in babies later on. It gives you the opportunity to start treatment before symptoms develop, and it can change the entire life course for that child. So newborn screening is incredibly important to protect the health of our children, and we are very excited that we are able to do this fully now at the Queen Elizabeth Hospital.
But how do you know? I haven't yet coughed. I haven't even expressed a bump on my body. How would you know that I do have a concern that we need to look at medically?
So there are different screens that are done. One is screening for hearing, and you really can't tell how well a baby can hear. Maybe a baby might jump for a very loud noise, but that does not tell you if that child can hear conversation level speech or a whisper, and that can affect how well that child is going to talk. So we're able to test very early on through special devices that will tell you whether the pathway for hearing is intact. We also test for certain types of heart conditions. You can't look at a baby and know if something is wrong with their heart very often. And so we check the oxygen levels to see if there's anything subtle that will allow us to pick up quite quickly that we need to pay more attention to this baby, do more testing, and intervene early before the signs develop. And in addition to that, we check for jaundice levels, which is yellowing of the skin. And finally, what we are introducing now is dried blood spot screening, where there's a little prick on baby's heel, and we are able to collect blood spots and send those off for screening at a lab in Canada, where they do very specialized tests, and they look for a range of about 40 conditions. And these conditions, for example, sickle cell disease or congenital hypothyroidism, which if they're not detected early, can cause major problems for baby. They're able to detect with these highly technological tests, and the information is sent back to us, and then we are able to tell the parents, listen, your baby has not shown signs or symptoms yet, which is fantastic, and now we can actually start treating your baby before they develop signs and symptoms.
Is this done for every single birth?
Every single birth at the Queen Elizabeth Hospital, it is offered to the parents. We can't force anyone.
I was just going to ask that
But
question.
I can't imagine which parent would not want to know if their child has something that we can prevent major complications from, and they don't have to pay $1 for it.
Unless they're hiding something themselves. And so it's offered to the home births. There's some situations, and you specifically said that at the Queen Elizabeth Hospital.
Yes.
There are other birthing centers on the island as well, and people do have home births still.
Yes.
What happens in situations like that?
So this is a pilot project which is being done in Barbados. This is the first time in the region that it is being done in this way. Barbados is definitely a regional leader in newborn healthcare, and nowhere else in the Caribbean is this being offered yet. So this is a project that was supported through the kindness of a grant from the Shaw Center for Pediatric Excellence. And so they have provided the funding for us to be able to do this. And in turn, we are going to work on transitioning and building local capacity to continue this. So at the moment, it is a pilot project which is being conducted through the Queen Elizabeth Hospital with the eventual goal of making it national and nationwide.
Okay. Babies, Dr. Austin, born differently. There are some who are naturally born and they will present with little to nothing. And there are others who are born with special needs. Immediately you know that you have that situation to attend. This is where you come in now as a pediatrician as well. Talk to me about how you then go about testing, because they're not your quote-unquote normal birth.
And that's a very, very real scenario that we face, Pearson. And, we're in the business of treating every patient the same. So, even though a parent or a child might have a different outward appearance, we still would go through the same screening process for every newborn who comes to QEH. Yes, it may mean that we may need to be, our approach may need to be a bit different, in the context that there may be other things affecting this family, but it is still important that we know, if this particular child is at higher risk of certain conditions, even because of what they're facing already. So I think that would be even more important for us to know at that point in time. So definitely newborn screening is something that we offer to all families. And as we mentioned before, the jaundice screening, the oxygen level testing, as well as the metabolic testing would be even more important for those types of patients.
It's a pilot phase we're in, but no doubt so far you've seen some results. You've seen some trends. You're picking up some things. What are you seeing?
Definitely. So it is early days in terms of the testing has only recently started, but this is something that we've actually been doing for quite a few years. And in the past, parents have actually had to, be the ones to fund this type of testing. So it's even more, significant that we're able to offer this to all families. In terms of the types of conditions that we're seeing, we do know that we have within our population certain blood disorders, so things like sickle cell anemia or sickle cell disease, we know is prevalent within our population, and those are some of the early results that we're experiencing right now. We do have certain other hormonal conditions or endocrine conditions like hypothyroidism that we may also be able to detect, but as you mentioned, it is still quite early. And, I just wanted to make it known that for the vast majority of patients, the vast majority of babies, they will have a normal result. They will have a negative result. So we don't want to be, in the business of fear-mongering, so to speak, but it is important for us to know if there's that possibility, but most babies will have a negative result.
And so, Dr. Birchwood, knowing the possibility empowers more so than scares you, because now you know that you have a team of medical practitioners at the Queen Elizabeth Hospital who are going to step in.
Yes.
And I know this is something that you've been doing for so many years in ICU, that you step in immediately for the sake of the child and the child's longevity. Because we don't want to lose any child.
Not a single child.
So let's talk a little bit about the process. Having seen the results from the screening, what happens next? That might cause some concern. What happens next?
That's an absolutely crucial question. If a baby has a positive screen, it does not guarantee that the baby has a particular condition. It is a screening test. What happens next is that we are alerted that there's a positive test. The child will then come in for repeat testing, repeat screening to confirm whether or not that child does indeed have a particular condition. And that gives us and the family the ability to intervene and to do something about that condition before the child develops symptoms. And so if there's a positive screen, repeat confirmatory testing is done. And once there is confirmatory testing, through our resources at the Queen Elizabeth Hospital and through our medical team, we are going to be able to counsel the parents, empower them with knowledge about what this means for their child. They are part of the healthcare team for their child. They are the most important part of the healthcare team for their child. And then we are able to either start treatment or prepare for symptoms that we know are likely to develop in a certain time frame.
I know of someone, I'm not going to call their name, whose daughter has been diagnosed with sickle cell.
Yes.
And all through her life from birth till now, she is so passionate about what you guys do that she wants to herself become a nurse. So she's studying to be a nurse as well. And so that's, again, a tribute to what happens at the QE. But I keep thinking also of the premature child, the child who is so small, so tiny, who I shudder at the thought of a needle coming close to its little precious skin. How do you handle a situation like that, Dr. Austin?
Well, definitely, premature babies, they are, as you mentioned, the most vulnerable, the most precious. So even in those patients, it is important for us to know. Definitely, we tailor the management to the size of our babies. So we use the tiniest needles that we can find, to make sure that it's as painless as possible. There is going to be a little bit of discomfort, but there are things that we can do to help through that, to manage that. So I would say, the little bit of discomfort is worth it to know, if there is something that could affect your baby lifelong.
Are there generally blood tests only?
You mean for the screening?
For the screening.
No, so blood testing is one aspect of it, but also there will be a hearing screen, which is also painless, and they put a little probe. Our lovely nurses, Sherelle and Leah, will put the probes in the baby's ear, and a little sound is sent into the baby's ear, and it's supposed to bounce back out to the microphone. So that's a painless test. Jaundice screening, which is also a painless test, where a device is put on the baby's forehead or chest and gives an instant reading. And then the final test is the oxygen level, the blood oxygen level, which can pinpoint the possibility of a heart condition or a lung condition that you can't tell by just looking at baby, but the baby might develop symptoms in the ensuing days or weeks, which could be life-threatening. So we want to pick that up as early as possible after the baby's born.
And then later on you do the vision test, or do you
Vision
do the
testing,
vision test?
we can't do the vision testing. Babies don't answer if they can see a letter or not.
Babies.
We try, but they don't answer.
But we can't underscore sufficiently the reason behind the baby, the new birth screening.
Yes.
I don't think we can underscore sufficiently why it's so important
Yes.
not to run from it, but to present. Within all of this, is there a way to track to ensure that every child is able to receive the screening?
Well, it depends also on parents
Parental
being willing
consent.
to, but as I said, I can't imagine a parent not wanting to know something that can help their child. But every single child who's born, our lovely nurses, again, Sherelle and Leah, are really expert at going to the babies, tracking down
Right.
the parents and getting their permission and explaining what everything is about. All the parents' information is taken, and so they are so good at it. If they see a parent walking around who they don't recognize, they'll be like, your baby did not have a hearing test. Do you want your baby to have a hearing test? They will see them in the supermarket and round them up and bring them into the hospital. They're very passionate.
We don't have
They're
nooses
very
around really on the infants, but yeah, we encourage you to come to have a test. Come have a test.
Yes.
And I keep thinking again of those who have the parent, the mother in particular, or the father, well, the parents, have another kind of medical condition, whether it is by abuse of a substance or unhealthy sexual practices. Are those also screened for very early in the newborn?
I will let you answer that.
That's a great question, Pearson. So generally, when it comes to our antenatal care, our obstetric colleagues are very good in terms of the initial screening that is done for pregnant mothers. So in terms of sexually transmitted infections, those are things that are screened for throughout the pregnancy. And if there is a risk to the baby, those are things that we're able to test for early and to be able to offer preventative treatments for. So those are definitely things that we can do. In terms of substance use and misuse, those are also things that we screen all families for when they come into us. So we tend to look at the patients in the whole. We always consider what's going on in their, personal lives, how we may be able to offer support to them. So that's definitely something that we focus on as well. While it may not be a direct part of newborn screening, it's definitely a part of our holistic care that we offer to all newborns here at the QEH.
I think we're so comfortable knowing that the QEH provides all of this comprehensive service to all of us. So we are very confident and very comfortable. And to those of you parents who are watching who think you can ride beneath the signs and ride beneath the symbol and the radar, don't do it. Don't do it. The nurses are watching as well. So early testing for a healthy life. Why is it important? We're sharing with you on the screen. It's a healthy start for your baby. That's the underscoring that we want to be. It's a really healthy start for your baby. When you know, you're empowered to do better. And empowering to do better means that you will go to the end of the earth just for your little sweet little birth. You went through the 9 months. It's behoved you now to really go the journey with them to give them the best start in life as well. So screening is absolutely critical. In terms of follow-up, so that again, you diagnose, you give me the results, I know the results, and then I escape. Again, I know there's no noose to trap and to say, hey, come back. But are you sometimes required to do, to just run you down a little bit and say, listen, you need to show up, you need to come in because there's cause for concern. That level of contact with the parent, is that happening? Built into the pilot?
Well, part of it is that our nurses and staff develop a relationship with the parents. And I think that a relationship goes a long way. When people understand that this is really because we care about you and we care about your child, they really do tend to show up. We have a database which was designed by this lovely lady here. And so the database contains all of the parents' information, contact information, which is up to date, addresses. So we will find you.
She said it like that again. We will find you. Dr. Birchwood, Dr. Austin, thank you so much. It's an important subject matter. I'm so glad that we had that opportunity to discuss it today. Thank you very much.
Thank you, and thank you to the
so
Shaw
much.
Center for Pediatric Excellence and for the support of the administration at the Queen Elizabeth Hospital for this project.
Thank you.
Thank you for having us.
Dr. Gillian Birchwood, Dr. Tanisha Austin from the Queen Elizabeth Hospital. We're looking at excellence in healthcare in Barbados, even from new births. And so we encourage you, allow your little new one to be tested because it gives you a really good start to a healthier life.
Morning, morning, morning. Good morning.